All right. What time is it? Telephone. Today, hopefully, we'll be able to talk about healthcare. Waiting for my guest to hook up. So bear with me. Can I sing you a song? Sing a song. La da da, la da la da da. Sometimes when you need to communicate to loved ones and people around you, I have to remind myself about my volume, the delivery. So, just thinking about what happened with, like, our kid, she's 11. She has a mind of her own. But trying to keep it is what they call in someone, Omosai. Yeah. Let's see if we can get our friend here. All right. Invited. So, send the invite to Mr. Scott Nissi, who is the CEO of Lyndon Baines Johnson, LBJ, better known, Tropical Medical Center, here in America, Samoa. There's been a lot of new developments with the hospital, and some big things happening. They've got a bunch of equipment for the dialysis unit, the CT scan unit, and their services are getting to the point where it is improving. I see it. A lot of people that visit the hospital see it. But there's still things that Kaunga address. So, Bohala me, if you see the, yeah, see you much sooner, Yaskaranesi. We're trying to connect with him. Da, da, da. And then, hello. See the thing that happening in the polo? Oh man. What drama. Yeah, the drama fan malo. Just like our drama fan malo. There's always gonna be conflict. Or let's say singa malo polo. Lower fuck out sanga. I believe this is their election year. Because we expect immediate change. Or the change on the or the change like if you're a person, a human, and you make changes in your life, it takes steps. That used to do, let's see, drugs. That's always a hot topic. They found Jesus. So, okay, you found him. That's funny. And that's what the things that concerns all of us. And now, not only with ASG, but different departments, but especially our hospital. LBJ is the only one we got. And it's improving, but little by little. Oh, little by little it's improving. As with anything, new CEO, new governor. The governor has his own priorities. This is to lead the government, to lead the people. So, the new CEO for LBJ, he has to lead the hospital. His duties are that chief executive officer. So me if I ungo me kong fight. There's a board. So they complained in the past about ER. It's always a hot topic. ER. Have you been to ER lately? No, thank you. Abi mo kang kalay, makiyala kung mai. They were misdiagnosed. That's a big thing. Misdiagnosed. Yeah. Or if in the past on unlawful death or things that were blamed on certain people from the last CEO. And so all these things, it's going to come back. But what we want to focus on is the current CEO and how he takes this, whatever his vision are. We will find out. Let's see what's going on with that. All right. Anybody have a question? Anybody have a question? So while we're waiting, if he ever gets to get the invitation, during the campaign, I remember me, the now governor, Mr. Hannessy is having trouble getting on, so momentarily. But there's also things happening around, like with the sports, with the baseball. The American Samoa baseball team baseball has grown so much and has dominated sports here from American Samoa. Volleyball is getting there. Soccer. What else? Handball. There was judo. Now you have boxing. Boxing, how you talk? Boxing is coming up. For far too long, the sport of boxing has been neglected by those that were operating it, because Mr. Jemias is a senior and he's got a lot on his plate. So hopefully, with what I know so far, that he's going to give the guard to younger people to handle that. And with people in key places like Diwa Sports Complex and all the things there, it has to promote this sport of boxing. Just yesterday, there was a total of 7 kids. We started with 2 fighters. Now we got a trainer, Sau'Ai from way back when. He's 74 years old. Has some equipment, has some mitts, and he's been doing that. So there's a lot of things happening. Let's see. We'll try to invite them. Mr. Scott Anesi, CEO of LBJ. If you're watching, you are watching, I did send you an invite to get in there. So I didn't know how to work if you have an iPhone or from the computer. Clueless to me, I'm just a dinosaur in that, as many people. Excuse me, it's been coughing a lot. Yeah, the change of weather. Wish we had snow. Not. So the sports, we've got a world class uh, sports coming out of American Samoa. Look at how many people we have in the NFL. How many people we have in. We got people in baseball. You know, we have people in volleyball, and now we have the upbringing or the bringing back of boxing. So you support all these sports. I try to, but it's hard to be on a schedule and show up. But give them some love and support them and promote them any way you can. When they travel, do travel ball or go to the Olympics coming up in 2028. I'm sure there's going to be a baseball team or other teams from American Samoa to compete in the big stage. Support that. Let's see. So, um, did you know? Did you guys know that things have been happening locally? The use of pesticides in our farms. These Asian farmers that are leasing land or renting land from Samoan families. I got nothing against that. What I have something against is the use of pesticides. Pesticides. The one farmer I talked to said, "You guys use pesticides?" Oh, yeah, okay. Because the pesticides, I showed him a picture of the pesticides that was found using in Futinga. He goes, "Oh, yeah, good, good." I mean, sorry about the broken English, but they use this, as is, bad. All right, let's see. Ta-dee. What is up with the connection today? All right. It takes a couple seconds to add Mr. Scott. There we go. Can you hear me?
Yes, sir. Can you
All
hear me?
right. This is Mr. Scott Anesi, the current CEO of the LBJ Tropical Medical Center, Talofa, and thank you for joining us today.
Talofa Lava, thank you for having me, sir. I
No.
apologize. I'm not this is the first time I've done this, so I'm not sure. I can't see you on the screen, but I can hear you.
Okay, okay. Yeah, I think, are you on the laptop?
I am on the phone, but there's I see my face.
Oh, okay. Yeah, so sorry. Okay, so I'm visible to myself, and hopefully others can see me and you together. But
Yes, sir.
so, how is the first 30 plus days? How
Uh,
has it
Um,
been so far?
well, I think it's, first and foremost, it's not what people think it is. One of the things you go to school, you talk about people, you talk with people, you have all of these experiences, but there's really no preparation for that first day that you're actually in the chair. You know what I mean?
Yeah. Yep.
And it's at times it can get overwhelming. We're talking about 900 plus employees, right? And my first day fell on a pay week. So as you can imagine, they forgot to give me the wristband for the signatures, and but I think with any organization, first and foremost, you got to get to know the people. You know, I'm in a new environment, but I'm also new to the workforce. And so my first week was really trying to get into all the departments. Just open doors. When I come to the hospital, I get curious. What's behind
Yeah.
that door? What's behind that door? I finally had an opportunity. to now go in the back and say, "Oh, what's back there?" You know what I mean? Kind of look under the hood,
Yeah.
kind of look under the hood, if you will. And then that's what I did. I mean, I opened up all the doors. I saw what was behind it, and more importantly, who was behind it, and had conversations. You know, gather intel there, and introduce myself. I am. I'm not new to the field or the game, but I'm new to the stadium.
Got it. Anybody can understand sports reference.
Yes, sir. Yes, sir.
So when you got into the job, um, there was someone else's vision. What did you see that, and most importantly, what is your vision for the job you're in?
Right. Well, I mean, there's really two things. You know, this is my eighth week, I believe. But you know, when you first assume a role, no matter what leadership role it is, as mentioned before, is you got to build relationships. You got to figure out what's going on in your workforce. Who knows this place more than anyone? So
Right,
first and foremost is the executive assistants and the secretaries. Let me tell you, in my experience, the people that are answering the phones, taking notes, and the ones that are in the front of these office know more about running this hospital than a lot of the people that sit in these chairs.
right,
So first and foremost is you got to gather intel, and that's what I did. I talked to all of these people, figure out what was going on, and
right,
then kind of assess what where we're at now. And then, of course, you do your expansion of assessments, right? So, I'm an epidemiologist. So, the first thing I wanted to do was I wanted to design an assessment plan. First and foremost, the assessment plan needs to address one, what's the current status? Number two is what are some of our immediate issues and our immediate needs? And then move on from there. What are some of the intermediate needs? And then what are some of the long term needs? Now, as you can imagine, I'm not only inheriting projects that are already there, but I'm also coming in the middle of a fiscal year, meaning
yeah,
I was coming into the tail end of the first quarter of the fiscal year, and the
right,
budget was approved using this vision, but also was partitioned based on some direction. So I needed to pull an assessment because one of the biggest mistakes that I feel that I've learned, and I've worked internationally, in the States as well, both private and public sector. One of the biggest mistakes that I've seen just in other leaders that I've worked under is that they come in too hard and too fast and try and make these massive changes. But they forget that it's a domino effect. You make a change here that trickles over to
yeah,
other places. And if you don't know the lay of the land, how do you know that some of those issues that the domino effect are actually going to be positive? And a lot of times they're negative. So
right,
what I realized is that what I feel the hospital needs right now in the immediate is competency and stability. That's at its heart. Now that's a trait that all leaders and all organizations need. But basically, they need a steady hand that's competent enough to evaluate what the issues are, but also has a plan to put in place so that
right,
you start seeing lasting effects. But you also need the buy-in from the people that are actually doing the work. It's one thing to be able to come up with a policy or a procedure and to make a
right.
decision, but it's another thing to see it
Make
through.
it work.
Absolutely. Absolutely. So, I mean, plan A was gather the intel, talk to the people, see what's working, see what's not. Number two is assess the current resources, figure out what our financial situation is, figure out what the needs are of the community and where I want to take this, but also making sure that they're in those increments, right? Your immediate, your intermediate, and then your long term.
Right,
And then if need be, I would rather go to the funnel and do, propose maybe budget reallocations or with a full plan in mind.
right.
I don't want to go too fast and say, oh, I need this, but have
And
no
so
justification.
what for?
Exactly. 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 And mostly I've just been reading. I mean, most of my afternoons and evenings when I get home are all about reading the history of the hospital, the history of the decision making,
Yeah,
the history of what went into the minds of the people. Now that I'm in the chair, I can feel the stressors that come with. I can feel,
Yeah.
the calls. I get calls from people I never got called from before, or never met before. But I want to read the history of the decision making and why things happened the way that they did, so that I'll be able to figure out how to navigate my tenure by learning
Yeah,
from what happened before me.
I see. Yeah, it's quite a, a feat there you gotta go through. Now, what can we see? Um, what can we expect for the rest of fiscal year from LBJ?
It's a great question. And it's really simple. We got to do the basics right. That's all. I mean, I'm a man that has a track record of building foundations that last. The issue here is that certain units are far ahead from other units. But when we're thinking about healthcare system, the system is all these moving parts that are turning the wheels of healthcare systems, right? But again, we got to do the basics right. We've got to, one, be able to reinvest in our people and our facility. Make sure that the product that we have is as best as it could be. We also have to look at our policies and procedures. A lot of the issues that are coming up are issues that were discussed verbally, or it's a lot of things that are not in place, right? Training regimens, policies and
Right.
procedures. Also, looking at just infrastructure, customer service. You know what I mean?
Yeah.
There's some low hanging fruit here
Yeah.
that we can kind of address. So, my plan is also to not stall the operation, but to look back at some of the low hanging fruit and some of the inefficiencies that we're doing here and just do those better. If we can there's no use expanding and trying to foster all of this new change if we haven't built that foundational step to be able to get ready for that change.
Right.
You know what
Uh,
I mean? So it's my focus is the basics. Evaluate the staff, address some of the inefficiencies that happened before, and do reclassifications from the top bottom. I mean,
right.
looking from how can I address a complaint of cleanliness, right? And then I pull a file, and the person
There's
hasn't
nothing there.
received an increment in 20 years.
Right.
We're talking about a portion of the workforce that maybe has been neglected over the years because we're healthcare first,
Yeah.
right? But they're an integral part. So it's kind of top bottom. I mean, and then I wouldn't feel right. I wouldn't feel right. So let's say, this is an actual incident. Complaint comes out on online social media. Supervisor pull the plugs. What do you think is going to happen? That supervisor is going to get very upset, right? Because now it's on social media.
Right.
Who do you and then who gets the short end of the stick? Right.
Yeah. The guy on top.
And what's happening is now we're expecting these people to now go in above and beyond, when we also have to have a plan in place to appreciate the workforce and
Right.
evaluate the work that they're doing and reinvest back in them. So I mean, I know people are waiting for all of these massive changes. They're coming, but the bottom line is it's time to reinvest not only back into our infrastructure but back into our people.
Right. Um, I want to discuss ER.
Absolutely.
I'm sure you heard the complaints and on social media and whatnot. Um, do you have like these complaints are fine and well. Everybody has their voice on what they complain about, either services or cleanliness. But is there a reporting where they can submit a formal complaint in writing, uh, just to your office, about these things that they experience? I
Absolutely.
mean, what
we're
is the process?
we're working on that now. We're working
Okay,
on that now. Is kind of, but I mean, my main message is, especially to our people, look, I hear you.
yeah,
I see you. I hear you. I am with you. I get it, but I'm glad you brought that up, because that's the only way that I can make a difference. is if I see these reports and these incident reports, etc. So we are trying to put in place both online, as I don't know if you noticed, but we're trying to revamp also our social media presence.
Yeah.
There's a lot of updates coming out. I mean, there's a lot of things that I feel that we can do better.
Right.
Um, we're also trying to evaluate a lot of that policy so that in the wards, but again, as I mentioned before, it's just these basics things, right? We're kind of progressing in a lot of areas, but there's a lot of these basic things that we need to fall back on, and things that maybe should have been in place before, maybe should have thought of before. I mean, but that's rather here nor there, because we can make a change now, and
Right.
that's something we're looking at.
Fantastic. Um, I'm a dialysis patient at LBJ, and when I got here on island 2.5 years ago, I was convinced by all of the social media press that was coming out of here that LBJ this, LBJ that. So I found Hope Dialysis and said, okay, it's a private facility, expecting that that would be the one. Let me tell you a little thing. My experiences at LBJ as compared to Hope Dialysis is like day and night. When Hope Dialysis went out of business June 30th, I believe, last year, I thought that there was going to be talk that maybe LBJ would absorb it. This is what just a casual conversation I had with the last CEO, the duo. And he said he was working on something that involved LBJ, but I didn't know until later it was an outside company that was bringing in. So now Hope Dialysis is back and running. It's good for the people that um, are in this area who don't want to travel far. But I give kudos to your dialysis unit. They are on top of it. Salvari, especially Olita, they are on top of it. I got to understand the different rates of what KTV meant about blood flow from LBJ, from Olita. And that they have gone above and beyond. Um, I also had a defibrillator installed in 2021. So when I was at um, Hope, they didn't really have any medical experience per se in that field. But then when Dr. Carter was here, he was the one that got the machine that matched my defibrillator. And so now Dr. Kenna is doing great, and I love coming to LBJ because I actually see the growth. What can we expect on the growing? Because I have found out, I'm sure you are well aware of the growing number of dialysis patients at the hospital. Do we see anything? What's in the future for that? Any expansion or because I know the chairs have arrived. Yeah, thank you. They're very comfortable, and those things take wear and tear. But what can we expect in dealing with these influx of dialysis patients?
Absolutely. That's a great question. One of the things that I feel we definitely need to address is the rate at which those become pre-dialysis to dialysis.
Right,
And we need to start a one prevention and intervention strategy with the Department of Health. That's one. We need to look at this as a whole, and it's very hard to react to something, right? We need to be proactive. Here at
right,
LBJ, our dialysis unit is reacting to the need when they're
right,
already on dialysis. But the growth of dialysis really is dependent on the incidence of those that are pre-dialysis going into, right? So one of the issues that we are trying to address it on the LBJ side is the CKD clinic, to figure out before we start getting to these end stages, to evaluate what our plans are to prolong that. But again, it's kind of like the old slogan in healthcare. Hospitals acutely address those that are sick, right?
right,
But we also need to work with Department of Health to make sure to keep the well, right? To
right,
make sure that the well don't fall into this category, and it's a balance. But that's one of the
right,
initiatives that I'm trying to push is uh, of course addressing the acute need, but also let's peel back the layers and evaluate what we're doing on the preventative side and the prolonged side. So that's one. Now on the actual dialysis unit, we're exploring. There's a lot of ideas that we're exploring. I mean,
Okay.
we're exploring maybe satellite sites, maybe also partnering with DOH since they have clinics. Or I think one of the biggest hurdles is evaluating exactly how to minimize the cost on the consumer.
Right.
And that, of course, goes to one is evaluating what the classification of reimbursements are, right? Are we going to
Mhm.
enroll them in Medicare or Medicaid? So there's some formalities, and I believe that that's one of the issues that you have with private facilities versus acute care hospital facilities.
Yep.
So it's all about the designation of what it is. So that's one. So it's going to be a procedural thing, and then there's an application of that. But we do need to definitely address how many of those are going on dialysis and try to address that. But also figuring out how do we prolong the life of those that are currently on dialysis and make sure that we're catering
Hmm.
for the public. And another thought that's also in consideration is separating inpatient dialysis versus outpatient dialysis. So we do have some. The dialysis unit has some plans. We're working closely with the board of directors. The board of directors has been very, very hands-on and supportive
Hmm.
of these initiatives. And we did have a meeting. So there are things that are working on in the pipeline, and hopefully we'll start to come up with some solid plans moving forward. But I do feel that part of the solution is fostering that partnership between LBJ and DOH.
Yeah. Getting them to handle it before it gets to the pre-dialysis stage. I wish I had that information, but then again, I was busy with the hustle and, and working in California. But that's okay. So, with all that said, my final question is there going to be a hospital, a renewal of a hospital, and some satellite clinics in the future with this ARPA money?
The ARPA money. Well, I might. Are you referring to the new hospital that was planned in Tafuna,
Yes.
or?
I'm referring to a new hospital that was planned. I know there's a hold on, I believe, if I'm correct, there's a hold on all these new projects, including the hospital. So if the governor, if that's the case, when the governor, after the assessment of all where the money is gone, I'm sure that we have until December 31st, 2026. So if there are these plans, let's just say for conversation's sake, would there be a uh, a redo of the LBJ and a satellite out here on the west side?
At the moment, I know that the ARPA funds have been a hot topic, and there have been some distributions, but I am not privy to a lot of the government discussions. But I will
Okay.
say that the intention is to use the money um, to reinvest back into LBJ. That's
Okay.
the current intention with that money. The allotment of the money and that I know falls back on ARPA, but LBJ is fully intended to use the allotment from that money to the programs that were not funded previously just because of funding issues, and reinvest that money back into this hospital's infrastructure as well as our programs.
Got it. Okay. Hey, anything else you want to add? A word, last word?
No, mean, I want to say that there's a lot of some issues going around, and I fully understand these issues. I also fully understand that the direction of the hospital. There's kind of been a time where it's been in the news and all, but so far the board of directors is in full support of the initiatives that I've implemented. They put their faith in me, They selected someone that was not part of the usual rotation. And I believe that sends a strong message to the people of American Samoa that we really need to get this thing back on in order and go on the right track. I mean, I you want to take this opportunity to, I don't know, I see like little chat things. I don't know if they're questions or can you see those?
Yeah, it's people commenting on,
Oh, all
same
right.
thing I was bringing
I thought
it
it
to
was you
light.
writing me.
Oh no. The audience, they come in and out, and this interview will be seen, will be posted on my site and also on the Sau'Ai podcast site, which is the podcast site, for people to view, and they'll come and watch it after work or, whenever they get a chance to. But Mr. Scott Anissi, CEO of LBJ Tropical Medical Center, I appreciate your time. I know it's very busy. You're in the seat, and then you've
Yes,
got a
sir.
thousand and one things going on a daily basis. But I appreciate you making time for Sawi Podcast and the audience. In the future, I know we're going to revisit these issues and get updated information from you in the future. But for now, thank you very
Thank
much,
you so
sir.
much. Right now, what I feel, my door's open as well. To the people.
Oh,
Just if you want to come see me, make an appointment. The hospital is. I feel we're headed in the right direction, and I know we're not moving fast enough. But
well,
please just have
yeah,
some patience with us. There's changes coming. Our CT is up and running, open to the public.
yeah,
We've got other developments. I mean, stay tuned. I know that it's a long time coming, but
yeah,
it is time to take a step back, reinvest in our people, reinvest in our only hospital,
yeah.
and set the course right. So thank you so much for your time. I really appreciate it. To the people, please be patient. We are working as hard as we can and headed in the right direction.
All right. Thank you very much.
Thank you,
Have a
sir.
blessed afternoon.
Yes,
All right.
sir. Likewise.
Yeah.
Tough time.
Bye bye.